afternoon. Thank you all for being here today. I'd like to discuss with you colon cancer. March is known as the National Colon Cancer Awareness Month. Colon cancer is cancer of the large intestine, the lower part of your digestive system, and then rectal cancer includes the last few inches of your colon. Together, these are known as colorectal cancers. Most cases of colon cancer begin as small, non-cancerous, also known as benign, clumps of cells called adenomatous polyps. Over some time, these polyps can become cancer. Polyps may be small and produce few, if any, symptoms, and for this reason, doctors recommend getting regular colonoscopy screenings. If there's no family history of colon cancer, then the beginning age for a colonoscopy is 50 years old. If you have a family history of colon cancer or cancerous polyps, then the earliest recommendation is 35, but will be up to your doctor's discretion. The Mayo Clinic states that colon cancer is the second leading cause of death of cancer among men and women, including non-smoking individuals in the United States. And according to the National Colorectal Roundtable, on average there are 135,000 new diagnoses of colon cancer in America each year. And of these newly diagnosed cases, about 1/3 of them will die from colon cancer. Here's a picture of the colon. This is where we start. We can go all the way through down to the cecum. Can you zoom in, Carrie? According to the Colon Cancer Foundation, the total amounts of deaths per year from colorectal cancer alone are around 500,000 people. Today I'm going to go through the process of a colonoscopy screening. That is what we use for diagnosing colon cancer. This here is our processor and the scope that is used for colonoscopy. The scope is roughly about 2 feet long. Your large intestine is about 5 feet. This is able to reach all the way to the cecum, which is the last portion before you reach the small intestine. We're able to reach it with this scope because it's kind of bunched up, so it does reach around. It's marked so we know how far into the colon we are, and if we do see a polyp, we can tell you exactly where it's at. At the end, there's a light so the doctor can see inside the colon, and there's a screen over there that they're able to see the colon on camera. Now, when you come in, you'll talk to the doctor, get family history and some personal history. They'll set you up for your colonoscopy, and the morning of, you'll come in. You'll have nothing to eat or drink past midnight. That way your system will be clean. We will get you back and discuss more family history and personal history. The nurse will then start an IV. A certified nurse anesthetist will come back, bring you into the room where you get to talk to the doctor, ask any questions or concerns that you might have. They'll then sedate you, and roughly the colonoscopy takes about 15 to 20 minutes. As I said, we start into the rectum. Here again is my visual aid. Start into the rectum. Here's the sigmoid colon. We go up into the descending colon, all the way to the transverse, down into the ascending colon, and to the cecum. After the test is finished, well, during the test, if we see any polyps, the doctor uses a bite forceps. It's this. It has little teeth on the end that he's able to grab the polyp and remove it. After we remove it, he sends it off to the hospital to be looked at under a microscope, where then they can tell us what type of cells are made up of that polyp. It roughly takes about 7 to 10 days for us to get the results back, and we notify the family members and the patient when we get that. Now, depending on what type of polyp or cells are found, it depends when the patient will be called back to get their colonoscopy for the next one. It can be anywhere between 1 to 7 years, again, depending on what type of cells are found. In conclusion, if individuals will keep up to date on their family history and preventative measures for themselves, this type of cancer can be treated and even prevented. Colon cancer is a slow-growing cancer, but if you fail to get your screening when it's time or when a doctor recommends, then it can grow and be very aggressive. The Again, the month of March is National Colorectal Cancer Awareness Month. So, if you have any questions about colon cancer or when it may be time for you to get your next screening, then please talk with your primary care doctor, and he will then determine if it's time or refer you to a doctor who can let you know if it's time to get your preventative screening. Thank you.